If you're over 60, every bite you take could be influencing your heart health more than you realize. While we often think of vegetables as universally healthy, the truth is more nuanced, especially for seniors. Certain vegetables, when consumed in excess or combined with specific medications, can pose hidden risks to your heart, from raising blood pressure to interfering with critical prescriptions. These foods may quietly undermine your well-being. Spinach is a prime example. While it's packed with nutrients and praised for its antioxidant properties, it's also high in vitamin K. This vitamin plays a crucial role in blood clotting, which can interfere with medications like warfarin, commonly prescribed to prevent blood clots. The danger doesn't lie in eating spinach itself, but rather in inconsistent intake. When seniors alternate between eating a lot of spinach and none at all, their medication's effectiveness can fluctuate, increasing the risk of stroke or uncontrolled bleeding. A consistent daily intake or a conversation with your healthcare provider about adjusting your dosage is essential. Pickles may seem like a harmless side dish, but they're often loaded with sodium. A high-sodium diet is directly linked to elevated blood pressure, a condition already common among seniors. Just a few slices of traditional pickles can exceed the recommended daily sodium intake, leading to fluid retention, stress on the heart, and elevated risk of heart disease. Opting for low-sodium versions or replacing pickles with fresh cucumbers can help preserve the flavor while reducing cardiovascular strain. Red chili peppers and other spicy foods can do more than just excite the palate. For seniors, the capsaicin found in these foods may trigger the release of adrenaline, leading to temporary increases in heart rate and blood pressure. While younger adults can typically handle these changes, seniors, especially those with arrhythmias or other heart rhythm disorders, may experience palpitations or even cardiac events. If you love spice, consider switching to heart-friendly herbs like basil or thyme for flavor without the cardiovascular side effects. Garlic is often hailed for its immune-boosting and cholesterol-lowering benefits. However, raw garlic has potent blood-thinning properties. When combined with prescribed anticoagulants, such as aspirin or clopidogrel, raw garlic can dangerously increase the risk of internal bleeding. The solution isn't to eliminate garlic entirely, but to cook it, which reduces its blood-thinning effects while preserving much of its nutritional value. Sprouts such as alfalfa or mung bean are frequently featured in salads and sandwiches for their crunch and nutritional content. Unfortunately, their growing environment is also ideal for harmful bacteria like E. coli or Salmonella. Seniors, whose immune systems are often weaker, may be especially vulnerable to these food-borne pathogens. In severe cases, infections can spread beyond the digestive tract and affect the heart. To reduce risk, always cook sprouts or avoid them entirely if you're in a high-risk group. Grapefruit is another fruit that seniors should approach with caution. While it's rich in vitamin C and antioxidants, grapefruit can interfere with enzymes in the liver responsible for metabolizing many medications, particularly those used for blood pressure, cholesterol, and arrhythmias. This can result in medications remaining in the bloodstream longer than intended, increasing their potency and side effects. Seniors taking prescription drugs should always consult their doctor before incorporating grapefruit into their diet. Cruciferous vegetables like kale and broccoli are loaded with fiber and vitamins, but they also contain high levels of vitamin K, just like spinach. Inconsistent consumption of these vegetables can make it difficult to manage blood thinner dosages effectively. The key is not to eliminate them, but to eat them in consistent, moderate amounts. That way, your medication can be adjusted accordingly, ensuring effective protection against clots or strokes. Eggplant belongs to the nightshade family of vegetables, which also includes tomatoes and bell peppers. In some individuals, particularly seniors with inflammatory conditions or sensitivities, nightshades can exacerbate joint pain or cause general inflammation. Although not harmful for everyone, if you notice increased discomfort after eating eggplant or similar vegetables, consider replacing them with alternatives like zucchini or squash, which are less likely to trigger inflammation. Cabbage is often praised for its fiber and cancer-fighting compounds, but when eaten raw, it can cause bloating and gas. This bloating can be uncomfortable and may even lead to palpitations. By putting pressure on the diaphragm and chest cavity, for seniors who are more sensitive to gastrointestinal changes, this can be particularly troublesome. Cooking cabbage helps reduce these effects and makes it easier to digest. So, what should seniors do when navigating vegetable choices? First, consistency is key, especially if you're on medications. Like blood thinners, sudden dietary changes can throw your treatment off balance. Second, watch your sodium intake. High-sodium vegetables, such as pickles or canned goods, can lead to long-term heart problems. Third, opt for cooked rather than raw versions of foods like garlic, sprouts, and cabbage, which are easier on the digestive and cardiovascular systems. Finally, maintain open communication with your healthcare provider. They can guide you on how to incorporate nutrient-rich vegetables into your diet safely. Even if you're on heart medications, bring a list of your favorite vegetables to your next appointment and ask how they interact with your prescriptions. A heart-healthy diet doesn't mean cutting out vegetables entirely. It means being informed, staying consistent, and making choices that support, not sabotage, your health. As we age, our bodies become more sensitive to what we eat, and a personalized approach to nutrition becomes more important than ever. Which vegetable surprised you the most? Leave a comment and share this article with someone you care about. Your heart and theirs will thank you. Thank you.